hip car. Now this is arguably the most difficult control articular rotation for people to do and do properly, because most people have a hard time disassociating their hip from their pelvis. Now they're two different pieces, okay? So when you think about your hip, I want you to actually think about your leg bone in your pelvis. And right at that point, that's where this movement should come from. It shouldn't come from your belt line where your pelvis is. Those are two different pieces and they should be treated as such. You should be able to keep your pelvis stable and underneath you while rotating your hip, okay? So we're gonna come back into that same position that we were just in. Knees underneath us, hands underneath us, and then we're gonna break this down into pieces before we go into the full thing. The first piece is just going to be flexion, pulling the knee in. Notice my spine isn't changing as I do this, okay? I'm not cranking through my spine or my pelvis. I'm staying tight through my core to solidify that position, and then we're gonna extend. Same idea. This is usually where people will dump into their lower back and have back pain as a result. So what I want you to do is just squeeze your glute and your hamstring to get that leg up into the air. So you're going to do a couple of those to get a feel for the difference between your hips moving and your pelvis and spine moving. Once you have that down, what you can then do is add another piece, and that's going to be abduction, okay? So abduction is taking the leg out to the side. So for this one, same idea. We're gonna bring the leg in first into hip flexion. We're gonna bring it up like a dog on a fire hydrant, and then back down, okay? So again, in, up, and back down. Do that on both sides to really get the feel. And then we're going to add one more piece and then put it all together. Okay, this last piece is internal rotation. So internal rotation is basically the feet outside of the hip. So if you look at it from the front, that's internal rotation. A lot of times when people internal rotate, they'll crank, kind of crunch into it. We don't want that. We want to stay nice and neutral so that we get everything coming from the hip and working on that hip range of motion and nothing else. So we bring it in, we bring it out, and from here, I'm going to try and keep this knee elevated while I rotate my foot up towards the sky, all right? So we're going to keep the knee elevated, rotate foot up towards the sky, fight this change in the low back that is going to want to come. We're going to practice that on both sides, knee in, knee up, and then rotate that foot up toward the sky, up and out, couple reps. Fight that urge to want to rotate, tilt. There will be a slight movement. That's natural, a very, very small shift, but it shouldn't be excessive. So when you go on one leg, it should never be large shifts. If anything, it's a minor shift of your balance so that you can stay on top of that knee, and then everything stays the same. Here's that movement all in one, and then we'll reverse it. So we're going to do 10 one direction, 10 the other. So we bring the knee in, hip flexion, core tight. We bring the whole leg out. We internally rotate by bringing the foot up, and then we bring it back into extension, that position that we already practiced, and down. Don't be surprised when you go through that extension if you feel your hamstring or it cramps in you. That's normal. Cramping is not a bad thing. It just tells you a range of motion that your body is not currently comfortable in a position that you probably need to work on for injury purposes, longevity, sorry. Okay? So once again, we bring the knee in, out, rotate foot up, lift it up as we swing around into extension, and then back down. We'll do 10 that direction, and then we'll switch directions before going to the other side. So we're going to curl that leg up, squeezing our hamstring, squeezing our calf into our hamstring, heel toward the butt. We're going to kick the leg up into extension like so. We're going to open the leg, rotating the knee up. We're going to swing it up so it's outside of our elbow, down and in. So once again, extension, external rotation, bringing that knee up into hip flexion, and then adduction. All right, so you're going to do 10 each direction and 10 on both sides. I'm going to show you from the front quickly what it looks like so that you can see how this leg is moving, okay? So take that breath in, breathe out, a little sniff of air into the lower abdomen and trap it, lock it there. Good. And then we're going to bring knee in with core braced, raise knee out like so, internally rotate that foot up, swing it around into extension and back down. Then we'll reverse that into extension, external rotation, knee up, foot down, knee outside of elbow, and down and in. So hopefully that second view gave you another perspective on how to do this and how to lock everything in place, what it should look like, and give you a better feel for kind of what you're getting into.